Hey, so today we're going to be talking about the uterus and the ligaments inside the pelvic cavity, but I want to introduce you to my favorite friend. Her name's Betty. So on a color scheme and brain coordinating the way that the brain works, we are going to be talking about each one of these ligaments and how. Okay, here's Betty. She is a uterus. We have the cervix. We have the fundus of the uterus. This is the uterus, okay? Sperm enters the vagina, goes and into the cervix, and if there is a fertilized egg, then the egg drops and meets the sperm. There, a baby grows. So after that, we will be talking about all these ligaments and how they pertain to the pelvic bowl. So here is the red cardinal transverse cervical. We have the yellow, the pubic vesicle. It has pubic, so it pertains to the pubic bone. Then we have the orange uteral sacral. It has sacrum in it. Sacral, that does pertain to the sacrum. Purple, which is round ligament pain. We all have suffered from that. We will talk about its function with that. And then we have our pink here, which is the ovarian ligament. And then last but not least, we have the green suspensory ligament, okay? So lots to talk about here. We're gonna be talking about anatomy and physiology, the function of each and every one of these ligaments, what they do in the body on an anti-inverted and anti-flexed version. Also, we're going to be talking about how these things can cause bleeding, can also cause pains during sex, as well as after having a baby and maybe even a cesarean, and how this all pertains to the Arvigo Therapy and the naturopathic approach that I do within my scope of practice with my clients. So stay tuned. Thank you so much. So in the above diagram, you'll see a uterus. A is a normal, anti-verted, anti-flexed version. In diagram B, excessive anaflexion. C is a retroverted. D is retroverted and retroflexed. And then E is first degree prolapse. It's when the uterus comes down into the vaginal wall. Second degree prolapse is F, and then G is third degree prolapse. It's inverted vaginal wall. So despite what the standard female anatomy diagrams show us here, not all uteruses are positioned the same. Having a retroverted uterus, it's also known as a tilted uterus. It's actually very common, and then the position changes after pregnancy. So what can that mean for you to have a retroverted uterus? Well, you can explore those options and positions and the possible symptoms by seeking advice from your practitioner. But the four main variations of uterine placement are anti-inverted. It means when the fundus is tipped forward. Anti-inverted or anti-flex, it means the body of the uterus is sharply tipped or bent forward at the junction of the cervix. And then a retroverted uterus, it means that the fundus is tipped backwards. Retroverted and retroflex, it means the body of the uterus is sharply bent backwards. So in Arvigo Therapy, things get stuck and we put those back in position. So here we're looking at the female pelvis and pelvic bowl. We have the uterus and the ovaries, and you'll see lymph and lots of arteries and veins, the stomach, and the liver. I've taken away the intestines, the large and small, just so you can get an idea of just some of the things that are in the pelvic bowl, because a lot is going on there and a lot can happen during pregnancy and after, and even just in everyday life that end up getting stuck in your pelvic diaphragm. So that's our first visual. Now, this is your second visual on a side view. The intestines are still attached. You see the sacrum and then the lower lumbar spine. But you'll also see the bladder, the uterus, part of the vagina, the pubic symphysis. All right, so here is another view, and you'll see the lower lumbar spine, the pelvic diaphragm inside the pelvic bowl, the sacrum, the bladder, the pubic symphysis, the vagina, the uterus. You'll also see the obturator internus muscle, maybe even an ovary. And I know that's a lot for some people that don't know anatomy and physiology, but we're going to talk about the function of these ligaments. So the function of the round ligament is a maintenance of anti-flexion of the uterus. It's a position where the fundus and the uterus is turned forward at the junction of the cervix and the vagina. So remember when I had Betty at the beginning of the video and I was talking about all that. So when this happens with the fundus and the junction, this does happen during pregnancy, but the cardinal ligament is what supports the angle of the uterus in antiversion. And then the cardinal transverse cervical attaches to the cervix, to the lateral pelvic wall by the obturator fascia and the obturator internus muscle. And then externally, this is fibrous tissue. It surrounds blood vessels, arteries, and veins, and it provides support to the uterus, which I've taken out arteries and veins and lymph just to give you a more clear visual, which that's also something that you need to think about on how much goes on in this pelvic bowl as a female. So the pubic vesicle ligament is a ligament that extends from the neck of the bladder and inferior to the pubic bone. It's divided into two branches. The lateral pubic vesicle ligament is the medial of the pubic vesicle ligament. And you can see that in here. So then will be the uteral sacral ligament. This is really interesting for me. It's strong and supportive and attaches to the cervix. It's the neck of the womb. And it's at the bottom of the spine. So you'll see it right there. And going forward later on in the video, I've taken everything out to show you where that is. So with all that being said, with Arvigo Therapy, a lot ends up happening in the human body. And when things get stuck, arteries, veins, ligaments, all those kinds of things, blood flow is an important thing for chi to flow. The circulatory system cannot flow adequately without this, and without the flow of blood, then things slow down. Our lymphatic system slows down, which we're at higher chance of infection, and you're unable to conceive. There's so many things that play a role in this. So that's why I'm trying to educate on things that are happening within the pelvic cavity and why Arvigo Therapy is so vital and important. So we'll come up with another educational video going forward. Thanks for listening.